my name is Lauren Apple. I'm going to be your nurse practitioner today. We're going to be doing a cardiac assessment. I'm going to start off by just assessing for any jugular vein distension by having you turn your head to the right. Okay, I'm not noting any distension on this side. It's less than 4 centimeters. Okay. Same thing on this side, no jugular vein distension, less than 4 centimeters. I am going to palpate your carotid arteries here. Okay, 2+ carotid on the left side, 2+ carotid on the right side. I didn't feel any thrills bilaterally. Next up, I'm going to have you raise up your shirt. I'm going to cover as much of your stomach as I can. Just assessing your point of maximum impulse here. Okay. I'm not seeing any pulsitations or anything like that. Next up, I'm going to feel your sternum here. This is your angle of Louis, so I'm just going to move my fingers across. None of this should hurt. Okay, so this is your aortic area. Feel a pulsation, no thrill. Pulmonic, I can feel your pulsation, no thrill. Tricuspid, can feel the pulsation without thrill. I'm at the second intercostal space for both the aortic and pulmonic, and then now I'm at the 4th intercostal space for the tricuspid, and then this is the mitral area, again at the 4th and the 5th intercostal space at the point of maximum impulse. All of those areas I can feel pulsitations, but no thrills or anything like that. The point of maximum impulse would be a normal amplitude. Next up, I'm going to go ahead and take a listen. So I'm going to first listen to your carotid arteries. I'm going to have you just hold your breath while I take a listen, and let me know if you need a break from that. Okay, no bruise on the right side. Okay, no bruise on that side. You can, if you're done holding your breath. Next up, I'm going to listen to different areas on your chest. First up, I'm starting with my diaphragm. I listen to the carotids with the bell. Okay, I'm going to listen to it with my other side of the stethoscope. Okay. So next up, as far as your heart sound goes, everything sounds good. You have an S1 and S2 beat. That's normal. Your rate is normal in the 50s. And then I didn't hear any murmurs or anything like that. So next up, I'm going to have you lay on your left side just a little bit. Okay. Okay. Okay, now I'm going to turn my stethoscope over and listen with my bell. Okay, I'm not hearing any mitral stenosis or murmurs or S3 or S4 sounds. I'm going to have you return to being on your back. And then I'm going to actually have you sit up on the edge here. And I'm just going to raise your shirt one last time. I'm just going to listen. I'm actually going to have you like hold your, like, lean forward a little bit, and then go ahead and exhale for me. Okay, I'm not hearing aortic murmurs while he's sitting upright. All right, next up we're gonna move on to the peripheral vascular portion of the exam. So I'm gonna have you scoot that way just a little bit, just so I'm able to get to your feet and everything. So I'm gonna have you hold your arms out straight. Okay, your arms are symmetrical. I'm not seeing obvious signs of swelling or anything. Your arms are pink and seem to be perfused well. Your hands are warm to touch. Your cap refill is good, less than 3 seconds in the hands. And then I'm just gonna look at your venous pattern. Your venous pattern is normal. You have great veins. I'm just palpating for this lymph node here. Okay. I'm gonna just assess your pulses here. Okay. Your radial pulses are 2+. Now I'm feeling your brachial pulse. Okay, and then this one. Okay, both brachial pulses are 2+. And then the epitrochlear nodes, were no swelling or anything there. Next up, I'm going to assess your lower extremities. So I'm actually going to have you lay back again. So, and then I'm just going to take off your socks here. Okay. So the color of your skin is seems to be normal. It's pink. It's blanchable. I'm not seeing any obvious signs of swelling or anything like that. So I'm first going to just start by palpating your femoral pulses. So this is located at your groin area. I would usually do this under clothes. Okay, that's 2+. Your posterior tibialis, your popliteal pulse. Okay, those are 2+ bilaterally. Then your posterior tibialis. Okay, those are 2+, and then on the tops of your foot, your dorsalis pedis. Both of those are 2+ as well. Your cap refill is good, less than 3 seconds on the left side, less than 3 seconds on the right side. I'm just gonna feel for your temperature. Using the back of my hand. Okay, your extremities are warm throughout. I'm gonna just assess for any inguinal lymph nodes here. There's no swelling on that side, no swelling on that side. Okay, next up I'm just going to assess for any edema. I'm pushing in on the cap here. 1, 2, 3, 4, 5. Okay, there's no edema on the left leg. Okay. No edema on the right leg either. Okay, I am going to do a arterial test of your lower extremities. So I'm going to hold your legs up at a 60-degree angle. This sometimes takes a minute. I gotta just make sure that your feet get pale. Now I'm going to have you sit up on the edge of the bed. Okay, return of coloring has gone to his lower extremities. That shows that his arteries are probably not insufficient. You don't have any skin rashes or lesions or anything on your skin. You have hair on your legs and feet bilaterally. your nail beds are pink and your nails are well groomed. I'm gonna go ahead and have you stand up for a second. I'm just going to check your legs for any varicose veins. Okay. Not seeing any posteriorly or anteriorly. All right, the last test I'm going to have you do is I'm going to have you sit back down, and I'm going to have you, on each hand, you're going to make a fist. One second. I'm going to take your watch off. I'm going to have you make a fist, and with your palm up. Okay. Now, go ahead and open your fist. Okay. Allen test was return of color on the ulnar artery. I'm going to have you close your hand again. Okay. And now I'm going to have you open your fist. Okay. Return of color with the radial artery occluded. Okay. We're going to do it on this one. Okay. Open up. Return of color with the ulnar occluded. All right, open up. Return of color with the radial occluded. All right, that concludes my exam. Everything looks really, really good. Thank you so much for participating today.